Consider Cannabis is not intended to be a substitute for professional medical advice, diagnosis, or treatment recommendations. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
I asked someone, I was like, hey, what's the best CBD oil? I don't really care about price because I'm spending $200, $300 a month on medication. That's not doing anything. It's not working. I'm just burning $100 bills.
It's time to consider cannabis. I'm your host, Curtis. This is the 15th episode of Consider Cannabis. Last week, we talked with Socrates Rosenfeld of iHeartJane.com, and if you missed it, I highly recommend you check it out. But not right now, because in a few moments, we're going to be joined by this week's guest, Kim, who will be sharing her experience using CBD to manage the symptoms of her Sutton's disease, which is not only extremely rare, but the cause of this disease is still unknown. Now, before we bring Kim into the studio, I want to take a moment to tell you about next week's show when we will sit down with Eyal Barad of Cannabix Pharmaceuticals. Cannabix Pharmaceuticals is doing groundbreaking work on the effects cannabinoids have on the cells of different kinds of cancer. It really is an exciting time to be alive. And while next week is going to be a great show, we have an awesome show coming up for you right now. So without any further delay, let's bring Kim into the studio and we'll consider cannabis together. So Kim, when was your first time using cannabis?
I was 19 and it was not great.
Yeah.
I was kind of a square in high school. I was afraid of everything. And I don't know why, but I was like, all right, I'll try something. Let's do this. So I had a big sleepover with a bunch of friends I worked with, and we all had pot brownies, and I was under the influence for a good 15 hours.
Oh yeah.
I slept great, but I didn't touch it after in years. So that was my first experience with it.
Did you feel like you were having a panic attack or anything during that time?
So,
what was bad about it?
Okay. Everyone around me, I guess they were experienced. So I didn't know what to expect. I didn't know what was going on. And then everyone got high and I just was waiting for it and nothing was going on. And then it all hit me at once. It just freaked me out. It was really overwhelming. And it was not a good situation for me. And looking back on it, it's just mainly a dosing thing. I should not have, if I've never experimented with anything like that, I should not have probably consumed it. I should have probably done something else, like maybe smoke it or something like that. Yeah.
Yeah, I really don't have a lot of experience with edibles, so I can only imagine what your experience was really like.
It was super intense. I'm kind of a control person. I'm diagnosed with OCD. Mm-hmm. So not having control of myself, that really tipped me off. And I was just so paranoid. And it just really turned me off from it. I slept amazing, but that just really took a really dramatic turn. And it was years after, and I never touched it again.
So 19 was your first time using it. It was more recreational.
Yeah, it was recreational.
Yeah. What brought you to re-exploring cannabis?
Okay. So I've pretty much just been sick for the last 18, 19 years of my life. I have this rare autoimmune disease called Sutton. I did not get diagnosed with it, though, until 2017, a week before my 25th birthday. I kind of was just exploring a bunch of different options for pain. I started out my morning with a Norco, and then I would do an ibuprofen. And then 2 hours later, I would give myself a Toradol injection shot in my thigh. And then I would just be having to wait when I can take my next pain pill. I would find myself 10 or 12 anti-inflammatory pills or pain pills by the time it was 7 o'clock. So I was just really tired of the pain pills, and I kind of saw where my life was going is the only thing that can help me go to sleep is Norco and a half bottle of wine. I just wanted to explore other options. I saw a way people were dealing with their pain with CBD oil. And I never really thought much of cannabis. I just saw that it helped patients with glaucoma. It helped people get hungry. It was more palliative care thing. I had no idea. It kind of came into my life when I was at my worst. I was working with someone, and she teaches cannabis education, and she's really knowledgeable of it. And she saw that I was just in horrible pain. It was a suggestion, but I always just kind of had it in the back of my mind, like, no, I'm not really going to do that, just because I didn't know enough about it. And then finally, my physical pain was really taking over my mental pain as well. And I didn't know really how to solve it, because with being in so much pain, I was not happy at all. It was horrible. I couldn't really focus on anything besides just my pain and how I was going to eat.
So can you, if you don't mind,
No,
I'd love to hear more from you.
Sorry, I'm kind of going
No, it's all
everywhere.
right. But I mean, you're talking about this autoimmune disease, a rare one that is causing you physical pain.
So
like what?
My autoimmune issue, it's called Sutton, and I will have canker sores in my mouth, anywhere from 10 to 14 all the time. And I've been to so many different doctors, and no one really knew what to do with it. Unfortunately, people kind of just saw it as like, okay, here you have your canker sore. Here's some alcyclovir. It's probably just like a strain of herpes, which is very common.
Mm-hmm.
But every blood work I've had, all the cultures, I didn't have that. I've done all elimination diets. I did a water fast for 2 weeks where I only had water, no food, nothing else. I just had water, and I would still get the sores. There was really no source of what this is from. And I was just struggling, and no one knew what to do with me. By the time I turned 20, I've been to 13 or 14 different doctors trying to figure out what's going on with me. And no one could really figure it out. I would spend so much money on blood work just because they think they find something. So they'll give me a medication. I was given gout medication.
Mm-hmm.
I was on a long trial of it to see if this would work, but the gout medication lowered my white blood cell count. So I had to get blood work done every single month. My blood cell count be lower. I was so fatigued, and they needed to up my vitamin D levels, because with my sores in my mouth, they get so bad I can't eat. It's just bread, rice, and whatever kind of animal broth I can stomach that day. With me not eating, I get stomach aches from all the pain pills. So there's another pill, will give me something for your stomach, the Zofran, and it's just this ongoing cycle of trying to make things easy on you. But there's just always a pill to replace another pill. It just kind of was this never-ending cycle. And it was just very frustrating. And it was very frustrating for my parents, too, because here's this kid that they always thought that I was stressed out. That's why I got all the sores, which is not their fault, because that's what my family doctor thought too. They thought that, oh, you're just a stressed out kid. It wasn't until I started dating later on in life, when I was 18 years old, my parents were trying to figure out, like, well, why do you get all these sores? Like, what's going on here? Like, maybe there is something wrong with you. And it never got figured out. And I even waited. I was on this really long cancellation list to see this worldwide known doctor. And he had an office in Anderson. I waited 4 months to see him. And I sat in his lobby for 2 hours, only for him to look at me for 5 minutes. And he told me, well, nothing's really going to work for you. And he gave me a prescription for the psoriasis cream. And he said, just leave that on your mouth and you're good. Just don't have any corn chips. His directions were just to not eat hard food and have this psoriasis cream. And because I'm using this cream for an off-label use, it was $300 for a cream that didn't work. But I was really excited because this guy's written maybe 3 or 4 books about abnormal mouth disorders. He was the guy to go to.
Right.
And I was so excited. I thought that he was going to be the answer to everything. And he kind of just told me, like, you're just going to have to kind of live with it. Sorry. And I kind of gave up after that. I gave it 2 years of me not doing anything, just suffering. And then I went to a new doctor, and she was really fascinated with my story. I didn't come to Cincinnati until I was in 2nd grade. My dad was in the military. So this doctor was so specific. She wanted to find out about the military base my dad worked in Okinawa. She was trying to see if maybe there was something that happened in the soil when I was younger. She was that specific. But unfortunately, she was also one of the best doctors, but she couldn't find anything until she had just like a random thought. I was working with her, I want to say, for 2 or 3 years. And then she said, I think this is what you have. There you go. You're diagnosed. And then I said, okay, what do I do from here? And she said, there's no treatment plan for what you have. You just have to work with it. And unfortunately, there are no new studies or anything. It's just one of these lifestyle things that you're going to have to get used to. And I was really sad because I'm just thinking, like, I have my whole life ahead of me. This was supposed to be good news. But she said that with it being autoimmune, my mood and how I'm doing mental health wise will really affect the way my body reacts and how, if I have all these sores. And I can't control this, which is not great for my OCD. But I do know the more stressed I am, the more sores I'll get. I was diagnosed finally. I was so happy about that, which looking back on it is kind of silly to be happy just because my thing just has a name.
I think it's validating when they do put a name to the thing that is causing your symptoms.
Yeah.
Because I know, especially when it's pain-related things, people are like, well, it's just in your head or something, you know, and it's not. I mean, okay, maybe it is, but I sure do feel it in my body. I don't know what to say.
And that's something that I always kind of felt guilty about it, especially with me working in the medical field. There are people with cancer. I remember, like, I had to write a letter for a patient of mine because he does not have any lower limbs, so he can't go to school. He has to make sure he has an elevator. And I'm complaining about my mouth sores. Why am I just kind of focusing on myself with these annoying sores when there are people who have bigger problems?
Yeah, at the same time, I mean, you should be able to live your life in a semi-comfortable manner.
Yeah, that's something I've come to realize. If things are affecting the quality of your life, then what are you doing?
How much of this is under control now with using CBD?
It's crazy. So I started CBD oil in October, and I noticed my sleep was getting better. Like 3 days into it, I got a solid 5-6 hours, which is unheard of for me. I realized maybe a week, 10 days into it, that I wasn't reaching for my pain medication as much. I wasn't reaching for my Lexapro as much. I just felt like I was more at balance.
So tell us, what did your CBD dosage look like? How often did you take it?
With CBD oil, so I was advised to do, I don't know how to phrase this. So I am always in pain, no matter what. And I asked someone, I was like, hey, what's the best CBD oil? I don't really care about price because I'm spending $200, $300 a month on medication. That's not doing anything.
Right.
It's not working. I'm just burning $100 bills. So I got this CBD oil and the strength is over 2,000 milligrams. So I started doing that at night. And then I eventually incorporated it into my daytime. So my current regimen now is at night, I'll do a full ml dropper of 2,000. And then in the morning, I will do, if I'm not feeling well with my pain, because I still get sores, but they're just not as bad. I will do sometimes I'll do a full tincture or I'll do half. And then throughout the day, I'll do 1,000. Like I'll do 1,000 if my pain's bad or if my anxiety isn't so great.
So you have two different strengths of tinctures
Correct.
that you take?
Yeah, just because that's just for me. I have to do something because if I do too much of the extra strength, like the 2,000, it'll teach my body to do what it's supposed to do. So if I'm tired and I take the 2,000 CBD oil, my body will just want to go to sleep. So it'll just be like, all right, I got your brain saying that you want to go to sleep. Let's go to sleep. But I can't do that because I have to function and work. So that 1,000 is appropriate for me because of my stress or if I need to focus on something. It'll still help with my anxiety and it'll still help me with my pain. But with me, ever since I started the CBD oil, my sores have been cut in half. Like currently, I have 6 sores, which it's nothing. Maybe my pain's like a 3 or 4, which I still cannot believe that. It's just crazy. I always am afraid that as soon as I say something's working, it's not going to work anymore. But this has just been changing my life because I'm able to do things. I had my first slice of pizza eating it normal because when I eat pizza, I have to press it down. I have to cut it into little squares, and it'll take me a good hour to eat one whole slice because the squares can't be like bigger than an inch or it'll ruin my mouth, and I can't deal with that. So yeah, it's rough, and it's just hard to act normal with it because I can't ever just go to a restaurant. I have to know where I'm going. I have to know what the menu's like because if I don't, then I can't eat. If there's a restaurant and they say that, oh, well, we don't do straws here, which people are trying to be environmental friendly, which I totally get. Love dolphins, love all that stuff, but I can't drink without a straw. I can't function without these little things that are supposed to make my life easier. But you don't want to bring that up when you're 26 years old. You don't want to go to a restaurant saying, oh, can I have a water with no lemon, no ice, room temperature, and a straw, please? Because you just sound like a diva. And I just don't want to explain like, oh, no, I'm just sick. Me being in the medical field, I always want to reassure my patients that I know what I'm talking about. But if I can't pronounce my words right, and if I can't say something, I will automatically lose trust with my patient if I'm giving them directions.
Sure.
And even going to the store, sometimes I would just be nervous to go to the store. I run into someone, they want to talk, and I'll talk, but I'll have like tears running down my face because it's hard to talk. Because with this, I get sores. They're not only on my lip, like inside my lips, they're on my gums, they're on my teeth, they're on my tonsils. It's hard to do anything. And the big drive for me with the CBD for actually trying it out is my tongue it felt like it was splitting, and I looked in the mirror, it was a half an inch of my tongue was a large canker sore. I couldn't do anything. I was at a new job. I called off work because I could not do a freaking thing. And I just thought that my world was, this was going to be it. I'm never going to be normal. And with me stressing out about that, it just really messed me up. And I just decided I'm going to try something new. And I had a meeting with someone who does the cannabis medical marijuana evaluations. I told them what was going on, and I was guided in the right direction. And I'm just so amazed of how much it's really had my body be at balance, because it's just changed my life. I can't say it enough, and it's just a miracle. And I hate saying that because it is science, but the fact that my endocannabinoid system was so essentially just shitty, no one could tell me that earlier. I could have had a normal 21st birthday. I could have go to a bar and have a drink with my friends and stuff. But no, I was at home just sitting with a pack of ice just on my face and trying to be normal. The fact that this is something that people don't talk about, it could really just help people with pain or just any kind of normalcy. It's really just disheartening. And for the doctor's office that I worked for, I was working for a big organization. This is something that was shunned, that we couldn't talk about. So it's just really shitty, and it's just heartbreaking, because I've seen, looking back on my medical career, I just think of so many people that this could have really helped, and it's just really sad.
Do you have a letter of recommendation, or are you a registered patient with the state of Ohio?
No,
not
yet. I'm working on it, it's kind of ironic, because one of the offices I work with, we do medical marijuana evaluations, but I'm using that adult excuse. That time just gets away from me. It's hard to find time for yourself.
Have you tried cannabis again since that 19-year-old experience, or are you just using CBD? That's it for me right now.
Okay. So I have tried to smoke pot twice in the last 4 months or so, and I'm doing it wrong.
You're doing it wrong?
I'm doing it wrong. I don't know.
How? What do you nothing's happening for you?
Nothing's happening.
Nothing's happening. Okay.
So it's really funny, because the first thing I asked was like, is it like smoking hookah? Because that's the only thing I know. When you are living in Ohio and you are not 21, the only thing you can do is go to a hookah bar.
Pretty much.
That's the only thing you can do, especially living in the suburbs of Cincinnati. If you're not a club kid, I love hanging out at home, watching Princess Bride, just chilling. So if I wanted to be social, my friends, we would just go to the hookah bars, which was fine, but that's the only thing I know about smoking. So when I tried smoking pot, I was just very cautious, and it just didn't work. Both times I've tried, it didn't work, and the people that were around me were really amazed that it hasn't worked yet. But I'm such a worrywart. I don't know if it would be a good idea for me to have the THC.
Just because you had a bad experience the first time, just take it easy, take it slow, and I want that. I want that so bad, because I've seen a lot of people benefit from it, just with the pain. Because if there's an alternative way for me to help with pain, especially throughout the daytime, because I don't know if you've had CBD oil, but that taste is not so great. It's not.
And CBD burps are really gross.
They're not as bad as fish oil burps, but they're not
very
fantastic.
True. Okay, very true. So, and I do like to think about my future. Like if I am in a situation where I'm not able to go to the bathroom, do my tincture, just do that, wait a minute. If I were to have a vape pen with THC, just do that and then I'm done. But I don't know. I haven't had a good situation for me to see if it'll actually work for me. So maybe I guess I just need more practice. So
Just curious, what you said you've done it twice. What were the methods you used?
just smoking. I don't know. I
Like a
think
joint,
just smoking
a
a joint.
bowl, like a
Honestly,
pipe,
I am the most square person you
water
will
pipe.
meet. People have to tell me this stuff. I have no idea what the hell's going on. So it was a joint.
Okay.
Yeah, I saw the rolling of the paper, and then we did the whole pass thing, the appropriate, like, mind your manners kind of situation. It just didn't work. I don't know. So, I mean, of course, I'm going to try again because, like I said, anything to try to help me. It's the same thing like having a glass of wine. You just want to wind down, and sometimes you just want to laugh. And I want to do that, but I don't want to destroy my liver.
Yeah.
And
I hear you there.
like I said, with me where I was last year, it was pain pills and pink wine. Not cute. Not good.
It will make you go to sleep, though.
Correct. So
For me, it was the CBD was working for my anxiety and depression. But my neck still hurt. Like, I mean, there's no doubt about it. So that's what made me really want to try the THCs because people were telling me, man, that's going to help. And it doesn't not every strain is for pain management. But when you get a good strain for pain.
The thing is, I've been in the medical field since 2014. So a majority of my adult career, and I don't know any of it. And it's really crazy to think that. And the doctors I used to work with, they don't know anything about it. And I worked with some great doctors, some really passionate doctors too, that would do anything for their patients. I witnessed a doctor take money out of their own wallet to pay for a patient's copay before. And the fact that the patient will know more about medical marijuana, what would be best for them, that just blows my mind. We spend a whole semester just studying on the heart, all the different valves of everything. But I don't know the difference between certain strands of marijuana and the terpenes and everything, but my patient will. And this is beneficial for their health. So it's just one of those wild things where I don't know the basic stuff. And it's just wild.
But you're getting there, right? You're doing the education,
yes,
right?
I am getting there.
Yeah.
And it's slowly work. But like I'm learning new things every single day. And I actually worked in the office before trying the medical marijuana because like I said, I wasn't sure if it was for me. It's something I never thought about until I got to that point. But I've seen it do really great things. I've witnessed it. I've seen people who get shaky. I don't know. I didn't know the patient's specific history, but I've seen some. I'm pretty sure they were about to have a seizure, and they took Charlotte's Web, and their whole body just calmed down. One of those quick, fast-acting things when I just think this would never happen in like a traditional office because you see how the effects work maybe a week later, unless they're bad effects, and they're just vomiting on the floor.
Is that the brand you use, Charlotte's Web?
No, I use bluegrass hemp oil at night, which is really good. They have a bunch of different strains, and they also do things like, because I'm trying to experiment with more of like my daily dose stuff. They have jams, they have peanut butter. Just
Really?
Yeah, just things
Fun.
to make it easier on you throughout the day, which that's something I'm starting to incorporate because I'm not completely off all my medication, but I'm slowly getting there. It's wild to think that if I'm in pain, I'll if I'm having a bad day, let's say that, just because I do still experience anxiety and
Sure.
all that stuff.
How could you not?
Correct. Yeah. So I will still have to occasionally do what I need to do to make me feel better. But as the weeks go on, it's been less and less medication, which I really do feel that it's making my body more at balance, because the CBD oil is telling my brain what needs to happen. Looking back, I've been on some kind of medication for anything since I was 14 years old. So my body's never really kind of had its own natural balance. It's just always negative, but it's finally nice to have a calm, grounded situation. And I really do think it's because of the CBD oil.
Awesome.
Yeah.
Awesome. So is there anything else you'd like to say to people listening who might be considering using cannabis as treatment?
I would just really say just be open to everything. There's just so many things that we don't think about as we're getting older. Yes, you take this maintenance medication and it's helping you for now, but is it going to help you later on in life? What are the effects going to be later on in life? What are the studies going to show? Is your brain going to turn into goo? Like, what's going on? But with this, you don't have to worry about side effects because you just have to wait a few hours. And with normal medication, that's not the case. And if you're in pain, you need to see what the safe, healthy options are and just really study. But kind of just have an open mind. That's kind of what I've been trying to stress to people. My parents, I love my parents, but they're very conservative. My mom is very Filipino. So she thinks that with me being on the cannabis, she thinks I'm not in pain, I'm just high. So that's why I'm doing so great. It's just one of those things, is trying to have an open mind and try to just have conversations with people. Anything could help. It could just be one little thing and it'll spark an interest.
Thank you so much for taking the time.
No problem.
Consider Cannabis is looking to record interviews with people who can attest to their experience with cannabis versus pharmaceuticals as treatment for the following conditions: AIDS, HIV, ALS, CTE, PTSD, Alzheimer's disease, epilepsy or other seizure disorder, glaucoma, hepatitis C, inflammatory bowel disease, Parkinson's disease, sickle cell anemia, spinal cord disease or injury, Tourette's syndrome, or ulcerative colitis. If this is you, please reach out. Are you using cannabis as treatment for a different condition? We would like to hear your story too. If you found anything of value in this episode, please share it with someone else. Remember to subscribe for free and get every new episode delivered right to your phone. Join me next time and we'll consider cannabis together.